not necessarily putting a hand into it, but enforcing education in some way, just to say.
So let's take education. Let's take, I don't know, they want us to eat well, right? So the government wants us to eat well. So, and I'm going to make some outrageous health claims here because I don't know. I mean, I'm ignorant when it comes to this. I'm to invent some stuff. So right now they tell us to eat lots of grains and lots of carbohydrates and very little fat and you know, and protein, but very little fat. Let's say, and actually there is a movement right now called paleo whatever, paleo diets. And call it crap or not, I don't know, it doesn't matter. But let's say some scientists come up and say, no, the real diet is eat lots and lots of fish and meats, and carbs are really, really bad for you. It turns out, according to paleo, grains are poison. Who's going to decide? A panel of experts chosen by what standard? And you think the grain industry is not going to lobby Congress to have the food pyramid with lots of grains? And you think the cattle industry is not going to lobby Congress to have lots of meats in the food pyramid? And who knows who else? Why is the government getting involved? You want to decide what kind of food to eat? Go sit down with your doctor, do some research, look on the web, figure it out. That's why they have, you know, dietitians out there. But why is the government getting involved in educating us on what to eat and what not to eat? All they can do, I mean, it's the same as, you know, why, and it's the problem of all government intervention. What position should they take? Is it 51%? If 51% think cholesterol is bad, we should go with cholesterol is bad? Or the latest scientific evidence by Lancelot Journal, or by the New England Medical Journal, or by the latest statistical study that shows that this vitamin is good for you and that vitamin is bad for you? What's the standard? The beauty of a market system of free people is I can decide that rat poison is good for me, and I suffer the consequence of that. And that's it. And I suffer the consequence of that. And we might disagree on diets. I might believe in paleo, and you might believe in the standard diet. Each one of us will eat whatever we want. And nobody's going to try to brainwash us to do otherwise. But it puts the responsibility on you guys. I mean, the nice thing about government is, I'm not going to read anything about diet. I'm not going to ask my doctor. I'm going to play, you know, stupid. And I'm just going to let the bureaucrats decide for me, and I'll do whatever they tell me. But, you know, if the doctor's in the audience, my view is, you know, I want to come to you for the expert advice, and I want you to give me the options and what's, you know, you're the experts, not Washington. And if I read something on the web and I disagree with you, I can go to another doctor. I can get a third opinion, a fourth opinion. That's the beauty of freedom. But as soon as you get government involvement in anything, in a food pyramid, you create special interest groups now around the food pyramid. Try changing it. You're not going to be able to. And on and on.
Yeah, I was just asking the question just because I'm just, as long as I can remember, I always thought of kind of our healthcare system as kind of a socialized government involvement. As long as I remember, anyone that's in need always gets a helping hand. Sure. It's kind of deal. Sure. And it just seems that if we're going to give people help, and I'm not saying I agree with socialized medicine 100% in any way, but I'm wondering how we'd go about offsetting the cost of the people that always are in need if we're not educating people to prevent the needs at hand.
You have to place this.
Diabetes is like
you know, ultimately, you know, I understand. Ultimately, right, you have to. But even diabetes, we don't know exactly what causes it. But you have to place the blame on the people. On people, you have to the responsibility on people. You have to let them figure it out. You have to let them suffer the consequences of their decisions. But what we do by socializing it is you make other people suffer the consequences of their decisions. And that's just not right. It's not just. It's not ethical to make me suffer because somebody else is irresponsible feeding their child sugar from morning to night. Right. And education should be done, you know, sure, doctors can get together and educate, pediatricians can educate. There are lots of entities out there that are in positions to educate that are better than Washington.